Thank you, MARPCON Latur. I assure this side that I will be within 15 minutes. The topic allotted to me was medical litigations, but I thought it to modify it to medication errors. Rather than looking at the iceberg, we will look at the base, what we are doing today. During next 28 slides, I will be taking you to a tour of medical errors which we do. To err is human and to forgive is divine. Errors in medical practice are as old as medical profession. Previously, they used to say that doctor is next to God, so he may do some wrong. But nowadays, every error is taken to the courtroom. This is not the only problem, but these errors increase the burden of healthcare by increasing patients, the money spent. The next question comes to mind of everybody is whether every medical error is medical negligence. So no, by definition, if you have duty towards patient, there is some deficiency in your duty which has resulted in direct effect causing damage to the patient, that becomes negligence. Though errors in medical practice are not uncommon, but they are unnoticed and underreported. But it is our ethical obligation to report it. So I will give an example during my residency. A patient was bad, was being planned to shift somewhere else. Our lecturer ordered for 50 ml of normal saline and then shift. So 50 relatives of that patient were standing outside the ward. And suddenly when my lecturer entered the ward, he said, "Oh, 100 ml IV has given, I have ordered only 50. With such comment, all 100 relatives rushed to the bed and to the sister. So though reporting of medical errors is obligation, but at appropriate place and to appropriate person for prevention of such medical errors in future and to improve the system. So what is medical error? It is failure of planned action to be completed as intended or use of wrong plan to achieve it. So I will give one example. A patient having empyema on left side, the doctor advised to put ICD and he left. Next day when patient died, the relatives had comments, why you have not put ICD? He said, oh, it was my duty that I have written to put ICD. Then whose duty it is? It is a duty one who writes the order. He has to see that it is being completed. And by mistake, if he has written rather than left side, put ICD on right side. And if ICD is put on right side. So there are these two types of errors. So it is failure to complete what is planned and wrong plan of it. Such errors can be serious, minor or near misses. Now my question to the audience, how many feel that they do at least one error in a month? Please raise your hands. So there are only 20% people who feel that they do at least one error in a month. We will see at the end of 15 minutes. So what are effects of these medical errors? They may result in death, increased hospital stay, higher medicine required, burden on already overburdened hospitals. So thrombophlebitis, patient has to stay there for another 2 to 3 days. That becomes overburden for hospital and that person also. Litigations and in total loss of revenue to the country. So when we search the literature, what is the status of these medical errors worldwide? In 1999, it was told that around $2 billion US is losing for these medical errors. And around 180,000 people die in US each year because of medical errors. Out of these 180,000 people who have died because of medical errors, 83,000 were potentially prevented deaths. So if the system would have been corrected, these people would have not died. And in 2002, one study says that 1 in every 5 American reports that he or his family member had encountered some sort of medical error. We will see few definitions. Adverse event is an injury that is caused by medical management and not by the patient's underlying disease process that resulted in either prolonged hospital stay or disability at discharge, or may have even resulted in death. Iatrogenic illness is anything that is resulting because of diagnostic or therapeutic modality, and adverse drug reactions is any reaction which is noxious, unintended and undesired effect of a drug which occurs at doses. So in therapeutic doses you have prescribed it and these effects have occurred. When we classify these errors, there are two types of error: errors of commission and errors of omission. So commission means something wrong you have done, like when an action is performed wrongly, wrong limb surgery or wrong drug prescribed. Errors of omission, so you should have done such thing and you have not done it. So a patient in anaphylaxis and you are running from your consulting because patient has turned bad after your resuscitation. So this is error of omission. There are two major categories of error. One is active error and latent error. Active error is the thing which you have done it. So given a wrong injection is active error. But keep your eye on latent error. So these are errors which are there in your system, but they have not yet manifested. Suppose you are admitting newborns in your NICU and you are not labeling them. At the time of admission, you are not taking footprint of that baby with sign of relative that this is my baby. And at the time of discharge, relatives may claim that we have given a male baby to you and you are returning female baby to us. Such things have happened. Untrained staffs. So these are all latent errors in setup of everybody of us. So do soul searching, do find your errors and correct them before they turn to litigations. So medication errors, it is a mishap, mistake or error creeping up at any stage in the process of ordering. In the rounds you have ordered, there was a discussion that we should change antibiotic and you just say, oh, give azithromycin. And delivering a medication, so your staff perceived that doctor has told to give injection azithromycin. So they have written injection azithromycin. The relatives have bought injection azithromycin and staff has pushed injection azithromycin. Then what happens? Patient dies immediately. So a medication error is a mistake occurs at the process of ordering, delivering a medication, regardless of whether injury has occurred or has just potential for the injury. So what are medication errors? Wrong drug, wrong dose, wrong frequency, wrong route, inappropriate dosage form. Some patient calls you that my child is having upper respiratory infection. You say take syrup Sinarest 5 ml and relatives have a Sinarest drop and they give it 5 ml. That is the error on your side. So inappropriate dosage form, indications, ordering unnecessary duplicate therapy, contraindicated medicines and handing over these prescription sheets to wrong person. So this is one Indian study. This will tell us what medication errors we do in our practice. It is in 2008 done in Madhya Pradesh. NICU, PICU and pediatric ward, 1286 children and 457 errors were identified. Out of these, medication errors were 68%, treatment procedures were 13% and all these. Because of, so when we are managing such patients, we are likely to do these much errors. Because of these 375 errors, mild morbidity was seen in 49, that is 10%, moderate in 5% and severe in 11%. When we systematically classify this error, incorrect medication, incorrect route, incorrect dose, errors in administration, overuse and underuse, Sometimes patient feel that this much syrup is too much for my child and they halve the dose. This is error on your side because you have not explained them the proper medication dose. Overall high doses, low doses, wrong schedule, milligram to ml confusion, wrong copy, extra doses required, and lastly, look alike and sound alike medicines. So though the medicines which look alike and sound alike can be confused by medical store, by your staff and patients. These are a few examples of orders given on papers. So digoxin, rather than writing 0.5, he has written 5 milligram IV. And the right hand corner notes, you cannot read them. So these are errors related to administration. Errors related to treatment procedures like exchange transfusion, pneumothorax, hyperthermia due to phototherapy units or probes of warmers. Errors related to clerical procedures, wrong weight is written because of similar names. Patients have given wrong treatment. Errors related to treatment procedure. Wrong procedure is done on other patients. And because of clerical procedures. Sometimes sonologists do copy and paste reports. So some pro forma is there, they just copy it, paste it. And in such situations, a male person can get uterus size. A male person can get pregnancy test positive. Errors related to equipment failures like defibrillators with discharge batteries, infusion pumps giving wrong doses, fatal burns because of phototherapy warmers, lack of labeling IV fluids, and milligram and ml confusions are important. So, if we summarize human errors in medical practice, they are related to medication, can be overuse, misuse or underuse. They can be regarding medication, routes, frequency, dose administration, treatment, clerical, diagnosis. Diagnosis can be missed, wrong or delay. Sometimes the system in which we work is at fault. So we just write prescriptions and we think that the medical person or our staff in OPD will explain them, and this doesn't happen. There is a case in Supreme Court where a patient was operated. He was out of anesthesia, taken to the corridor. The ward sister ordered a mama to bring the patient. When that patient was brought to ward, patient was brought dead. Now who is fault? Surgeon says, I have operated well. Anesthetist says, I have taken the patient out of anesthesia and handed over to staff. Staff says, we will say he was okay. We handed over in the corridor. The mama doesn't come to take him to the ward. So in such things, the system is at fault. So we have to correct such systems in our hospital so that we should not face litigations. Causes of preventable medical errors are understaffing of doctors, nurses, overwork, stress, no communication between professionals in hospital, language of staff, doctors and patients, failure to work as a team. So, last but one slide. We should do soul searching. Now my question, how many of you do medical errors every day? Please raise your hands. So others are sure that their patients are taking appropriate dose of medicines what they have written. So this is a poster by WHO. Health workers, before you know your medication, check patient medicine route dose time. Ask your patient if they have understood. Patients and caregivers to know your medication, check the dose, ask your healthcare professionals. Thank you. Be safe and keep your patients safe. Thank you.